Hey guys, this is Kyle and Travis, and we're with Beyond Bipolar blog. So I've been watching a lot of videos on YouTube with very high educated psychiatrists, therapists, slash life coaches. The ones I've been mainly watching are primarily PhD psychiatrists. Is Dr. Jordan Peterson. Dr. Jordan Peterson is really good. He's a conservative, but he's had a backlash because like I said, he's conservative, and there's a bunch of people that were kind of uh, bickering at him and kind of having a mob against him because he did not support uh, transgendered people, and he felt like there's only two sexes. But anyway, there's another guy that I've been watching, Dr. Gabor Mate. He focuses on childhood and healing that inner child, and that a lot of people's issues stem from uh, a wounded inner child, basically. And the third one is actually kind of new. He's an Indian guy. That's Dr. K. I've been watching a few of his videos. He seems to give really, really good interviews with people, and he's kind of new to the game. Apparently, he was addicted to video games, and he moved to, and he was going to school, but he ended up dropping out and failing because he was addicted to video games. So he became a monk in India, and he somehow turned his life around and came back and ended up getting a medical doctorate, and he's actually a psychiatrist, and he has his own YouTube channel called Healthy Gamer GG. So I wanted to watch one video. This video was about psychiatrists clarifying the points of therapy and hospitalization. It was kind of an interesting one. I didn't watch all of it, but we'll react to it and see what my brother thinks and what I think. Okay, let's get started.
Okay. Trying to be honest with my therapist, but not so honest that I get involuntarily hospitalized. Okay. So we're going to talk a little bit about involuntary hospitalization. This is just going to be kind of educational, right? So first question, chat, is what is the goal of hospitalization? Y'all know? So like the goal of hospitalization is really for like safety and stabilization. So I know this sounds kind of weird, but like 99% of patients who have come into my office and said, I have suicidal thoughts, I have not hospitalized. Okay, so involuntary hospitalization is really should be used in only like drastic cases where there's like an acutely elevated risk of safety. So I've worked with people who have been suicidal for like a year, and they'll come to my office and they're like, I'm thinking about killing myself. And I still may not hospitalize them. In fact, I usually don't. So the main issue is whether there is an acute elevation, a temporary elevation of your risk that is very problematic in that moment. And if the answer to that question is yes, then we will consider involuntary hospitalization, or at least me personally. So that's also where I would think of.
Personally, I think there's a huge difference between having suicidal thoughts and suicide with intent. Because if you have intent, well, that clarifies you that you are going to take your life. So I don't know if this is what he's talking about, but I feel like suicidal thoughts, if you're just saying you're suicidal, I don't think that clarify you to be hospitalized. I had suicidal thoughts and lasted for several months, 6 months at least, and no, a year at least. And the thing is that I've only had like 3 hospitalizations. It's a lot in a year if you compare to many people, but in general, based on all the suicidal thoughts I had, I didn't go to the hospital every time that I had suicidal thoughts.
About voluntary hospitalization. So most of the people that I've worked with, like, will do a voluntary hospitalization, which is, I'll talk to them, right? And like our goal, so when I work with my patients, we have a shared goal. The shared goal is not to, keep them living life that is miserable. The shared goal is to try to help people build a life that is worth living. So if I feel like they're so mentally ill to where they're like acutely at danger to themselves, then I may involuntarily hospitalize them. But generally speaking, psychiatrists and therapists are not there to hospitalize you against your will. That's not what we're there for. We're there to try to help you. And just because you're suicidal doesn't actually mean that you belong in a hospital. Like, at least, I mean, it depends on what kind of suicidality. So we'll go over that in a second. But really the question is, is the risk to yourself so great that you need to be in a controlled environment for a temporary period of time? And so this is where, when I work with people, like, I think about the following factors. One is there a temporary elevation to the risk? Do you have means or access to kill yourself? Do you have a plan to kill yourself? So like some people are like, I just want to die. They don't really have any plan to do something. Whereas other people are, and if I ask them, like, do you have a plan of what you would do? They'd be like, yeah, I jump off the Golden Gate Bridge. And I'm like, the Golden Gate Bridge is in San Francisco and you're in Boston. So would you buy a ticket and fly? And they're like, yeah, I haven't really thought it through. I'm like, great. So you probably don't need to be hospitalized in that situation. So the first thing to remember is that, our goal is not to hospitalize you against your will. And just because you're suicidal doesn't mean that we're going to hospitalize you. It, of course, is a case-by-case basis. Different clinicians have different thresholds. I tend to be like a big believer in patient autonomy. And sort of like, so I think that it's my job to really, sometimes I'll involuntarily hospitalize people because I don't think that their mind is working properly. And so we'll do something called a capacity eval to see if their mind is actually functioning in a way that's processing information, or they're too depressed to be able to process information. But just because you're suicidal doesn't mean that we're going to hospitalize you. In fact, like, our goal is to help you not be hospitalized, right? So when I think about my job as a psychiatrist, my job is to keep you out of the hospital if possible. Right? So if you think about it, that's the job of all doctors. Like, if you go to a primary care physician and you've got like an infection, the goal of the doctor is to keep you from needing to go to the hospital. Like, we don't want to get this to a point where you're septic, the infection is like flowing through your bloodstream and like, it's affecting your entire body. The goal is to keep you out of the hospital. It's not about cost savings for the insurance company, things like that. That's not what I'm talking about. What I'm talking about is, generally speaking, we want to keep people to a minimal level of illness, right? So our goal, and so this is where I'd strongly encourage you to talk to your provider if you're having suicidal thoughts, because it's their job to help you be safe. It's their job to help you like deal with those thoughts, hopefully, so you no longer have them, or they're like much more controlled or way easier to deal with, because that's our job. But if you don't tell us because you're afraid of being hospitalized, like, yeah, you could be hospitalized, it's possible. But if you don't tell us, then like we can't help you with them. And the hospital is not really what we want to do. Like, that's not our go-to. It's like a last resort. That being said, there are some providers who, for medical legal reasons or, personal thresholds, have a lower threshold to hospitalize people. I can't speak for everyone. But generally speaking, I think that, if you have suicidal thoughts, like, you should tell your provider, and then your provider will sort of ask you certain questions. This is the other thing I know it sounds shocking. But also, if your provider wants to hospitalize you, you got to really think about why they want to, right? Because as trained professionals, we sort of know what the risks are. And so if you're like really high risk for suicidal, like an actual suicide attempt, and your provider is telling you to do that, maybe you should go, right? Because like they kind of know what they're talking about. And our goal really is to help you stay alive and stay healthy. So, don't hesitate to share your suicidal thoughts with your provider. This is also where, like we said, we think about acute elevations. So has something really drastic happened to you? Did you just get dumped? Do you have access to suicidal means?
Just want to say that, there's a lot of people in the past, especially me, I can relate to it, that I've downplayed my suicidal ideations because I honestly didn't want to get help, and that was primarily the thing. I denied getting help because I didn't believe in my mental health. I didn't believe in getting better. I just thought, woe is me, might as well just live, woe is me, and things like that. But I still feel like coming back and looking on the things is that it's very important to be honest with your psychiatrist, therapists, and other type of support. Well, if they support you in a way, try not to stress them out, but trained professionals is what I'm trying to get at, is that if you are in a position where you do want to harm yourself, it's probably more beneficial to let them know than to hide it from them. And if you're afraid to go to the hospital, well, I still feel like it is in the psychiatrist's own desire for you to get well and to keep you safe. So in general, I still feel like it's better to go to the hospital than not. If you have the intention of suicide, if you're just having suicidal thoughts, I would wane on that and maybe focus on dialectical behavioral therapy, like activities, distractions, or other types of therapeutical things that you could be doing. Has there been any time where a provider or psychiatrist or therapist pushed you in the hospital then, and that you were scared? Nah, but there was the opposite. I just feel like there was this nurse practitioner. I think there's a huge difference between a nurse practitioner and MD. The nurse practitioner literally let me involuntarily put myself in the hospital 3 times in a year. I went to an IRTS a year. I had partial hospitalizations before the IRTS, and she literally declared, like I said earlier, for me to not help me out. She just declared that she didn't want to be my provider anymore. And I think that is the worst thing that a psychiatrist can do for you. I told her that I might have had the Steven Johnson rash from Lamictal. She didn't even want to look at that. She just felt like the other doctor was making the clear specification, even though she or he was not a psychiatrist. I still feel like there's literally bad psychiatrists that... How old was this lady, and who was it? I mean, you don't have to give her a name, but where was it?
This was at
U of M or
no, this was at
Nystrom?
Nystrom and Associates, because I don't know if you met her, but I was with her with my mom a few times, and
How long were you with her for?
a year.
Oh, it's quite a bit.
So I was with her a year, and she didn't say anything about going to the hospital. She just literally tried to tell me that you don't need antidepressants. It's gonna make you manic, which makes sense. But I feel like I was more in a danger myself by not being on antidepressant, by not taking the risk.
Is that common for psychiatrists to prescribe antidepressants for bipolar then? Or it sounds
Maybe for a nurse practitioner, she's never heard of it, but
Oh, she's a nurse practitioner.
Yes, that's the thing.
I remember she wasn't a doctor.
nope, she wasn't a doctor, and it kind of sucks because I don't know if you guys know about psychiatrists, but it's very, very difficult to get a psychiatrist. There's few compared to the ratio of many people with mental illness. So
That was my first psychiatrist. That was the one that actually, where I mentioned in another video where they're pretty much loading me with drugs, and it wasn't good.
So they didn't specifically focus on your well-being. They just focused on, like, maybe book smart research. But generally, the most important thing is to make sure that the patient is living a well-to-do life to the best possible knowledge. And there's some that just want to over-medicate you. There's some that just don't invest their time into helping you, and generally that can be very, very frustrating. So my advice to you, if you're struggling with someone that might over medicate you, that isn't listening to you, that isn't expressing to you on how to help you with the suicidal thoughts or coping with suicidal issues, I still feel that you got to keep looking around. You will eventually find someone if you keep looking around. And it's very difficult for people that are on MA, because there's some that are out of network, and you'll realize that they don't insure people on medical assistance, and you have to be wary about that. So that also decreases your chances of finding a good psychiatrist. I'm lucky that I found one. I'm lucky that my brother
Went
was
through a
able.
lot of them though. Mention that.
I've been through a lot, and primarily in the beginning was because of me. I
State
felt
the
like I didn't want to.
experiences.
I felt like I didn't want to get help. And the first one I had was actually at U of M, which was a resident, and just literally poured with
No,
med
the first
after
one was
med
nice,
and med.
wasn't it?
No, the first one was
Oh.
U of M.
Oh.
So they literally poured me with a whole bunch of meds, and they didn't really help me at all. And then I went to one that I eventually didn't even see at all, because I just ran away and
To the bridge.
hitched a ride to the bridge, basically just walked away. And I was literally in denial of getting help, because I felt the medications caused so much stress in the past that I didn't want any more medications. So then I ended up going to a guy because I wanted to try to form a relationship. His name was Naveed.
That was mine. He's
And-
pretty good. I feel like even though he was just a nurse practitioner.
I guess it's important to note that I did have one in 2012 when I had a partial hospitalization. It was like an actual MD that took care of me. It was the first time I started Lithium.
How were those people in the hospital?
Just
It's like-
unfortunately, they were pretty cold. Unfortunately, when I told them I didn't want to be on Lithium because I didn't believe I was bipolar, he literally told me, "You are bipolar, you need to take Lithium." And I don't know, it doesn't help that much. I just ended up taking it for the sake of shutting him up, which is kind of a bad excuse. But generally, you got to keep your options open, guys. You got to try to find the best psychiatrist. You got to try to be open and honest with them. You can't lie to them. Don't sugarcoat anything. Just keep continuing.
There's a time that you're really, really mad at him. Yet that's ironic that you support meds when you're really mad.
Because there was a period of time where I was off medications for 3 years, and I was just...
Remember we made that video of you and I butt fucking each other because you're mad.
Yeah, that was in 2009 and 10 when I was just on a whole bunch of drugs.
You're mad, and you made a music video
that called
post trauma.
Caused a lot of akathisia, and that was...
But you still support meds, even if
I support meds to the extent of you got to keep trying to find the best one for you. I don't support in trying medication, staying on it, making you miserable. I would keep trying to search for the right meds. However, you want to be careful that it does take some time for the medication to work. If you're having overt reactions like akathisia right away or causing induced suicidations, of course you want to get off them. Or even if with weight gain, you might want to get off them in the long term. But you still got to try to keep searching for the right man. I believe I'm a big proponent of medication. I feel like it helps and benefits
So
people.
even if people are scared, you're encouraging them to still go and do it.
Yes.
And that also is because if you look at it, 80% of suicide attempts were actually the decision was made within 2 to 5 minutes. I think maybe 60% is made within 60 to 120 seconds of the attempt. So if you ask survivors of suicide attempts and you ask them, when did you actually decide that you were going to kill yourself? 60% of them, I think, say within 1 or 2 minutes. And 80% of them will say within 5 minutes of the attempt. So it's a very common myth that most people will plan out their suicide attempt over a long period of time. That's why we ask so much about access to stuff. So if you have a gun in the home, the problem is that if you have this idea and within 60 seconds you've got the gun, you may actually pull the trigger. So we try to control means. If you have to book a ticket to San Francisco, like for next Tuesday, the likelihood that attempt will happen is statistically way lower, according to the research, as I understand it anyway, based on my last reading of it. And so that's why, when the provider tells you, hey, I really want you to go to the hospital, they're not necessarily worried in that moment. What they're actually thinking, hopefully, is like, what is the likelihood that that little voice in your head actually takes control of you for like up to 5 minutes?
Another interesting thing about suicide is that you probably might mention that most people who are suicidal, this kind of relates to what you're saying, they won't even tell anyone. So usually if somebody's telling you, it's likely they're more asking for help and not really actually
trying to
taking their own life. So they're trying to resolve those issues. So,
but
those
should literally be taken seriously, because that is kind of a plan of attack. So they're crying for help, but they're asking for the sake of that they're just miserable and they want to eventually take their life. You got to take that seriously. There is things that you want to try to be open and honest and non-judgmental. You want to kind of not probe them, but you want to just listen to their problems and just listen. That's probably the biggest thing that they really want. Just use it.
And if the little voice that you fight against on a daily basis can take control of you in 5 minutes, what is the worst damage it can actually do to you? That is our threshold to hospitalize. Because when that risk gets too high, that's when we really think about hospitalizing. And even then, like what I'll do, I've had cases where people have had very high risk situations, and it sort of becomes like an issue of trust where I'll explain this to them and say, I trust you now. I get that you're telling me that you're not actually going to do anything. I'm concerned that you could change your mind in the middle of the night. So let's get rid of the gun. So I'll talk to the person, they'll talk to their spouse or mom or whatever.
So, and this is another issue with politics. It has more to do with the NRA. So I know there's a lot of gun people that's saying you can get rid of the guns, but in the end, they believe that if they give up our rights to bear arms, that there could be a government takeover and we don't have anything to protect ourselves. That's more of the Republican view. The Democratic view is that they believe that it's okay getting rid of the big guns because, one, they could shoot and harm people, and then there's another question: why in the hell can a mentally ill person get access to a gun? How is that possible? I mean, anyone can get it to the black market, but with men, they're impulsive. Honestly, if you really think about it, if they didn't have that gun, they wouldn't probably shoot anyone or kill themselves. So I don't know what your viewpoint of it is.
I still feel like if guns were not in the hands of people in general, that there's less likely to be in the hands of people that are mentally ill. Now, probably there is some emphasis that these mentally ill people do need to have more therapy, that more resources do need to be put in mental health versus getting rid of the guns. But for safety reasons, this guy literally says if you have access to a gun and you're impulsive, well, it's probably better to get rid of that gun.
And I tell them what I need to be reassured is like, I need your mom to be with you and y'all need to get rid of the gun together. And the three of us are going to talk about it. And so if we can be assured that you don't have access anymore to make an impulsive decision, because most suicide attempts are actually impulsive decisions, then we can sort of keep you safe. And if we can keep you safe on the outside, then, we don't need to hospitalize you. The last thing that I know, it's shocking, but hospitalization is not a magical cure for suicidality. So this is the other reason that I tend to be really careful about when to hospitalize people, is because I really have to ask myself, what's going to change within 1 week? Now, if you just got dumped by your partner and you're like acutely suicidal, then absolutely in a week you could process a lot. You could be in a different headspace. So by all means, move towards hospitalization. So this is where the other thing that we talk a lot about in psychiatry is a chronically elevated risk of suicidality, which does not necessarily warrant hospitalization. Some people have a chronically elevated risk of suicidality, which means that they're sort of constantly high risk to be suicidal. And even if it's scary, it doesn't necessarily mean that you need to be hospitalized, because it's unclear what will happen over the course of the 10 days that you're in the hospital. If it's not going to actually make an impact, we just kind of ride out the risk.
Isn't hospitalization usually for about protection mainly?
Just
not really a change, just
safety.
safety and protection, so they don't kill themselves. It's more That's really what it is. Emergency to keep someone alive, right?
I'd rather have someone in the hospital than not in the hospital if they have the intention of killing themselves. So,
right? We talk about it. I'll oftentimes try to talk to a patient's family member, spouse, or parents or something like that. We say, hey, here's the situation. What do you guys want to do? We can try hospitalization. We cannot try hospitalization. Based on my assessment, this is a chronically elevated risk. Is it scary? Absolutely. But I don't know that hospitalizing you for 5 days is going to change something. Yeah, so Riyadh is saying, my first time calling the suicide hotline was last Thursday. Good that you called, and don't hesitate to call again, and like go to the emergency room if you're feeling like you're in a bad spot. So this is the thing, is like, remember, hospitalization is sort of like, it's basically the alt for the psychiatry profession, right? Like, we don't spam your alt. You can't spam your alt. It doesn't do any, I mean, I guess theoretically it would be good to spam your alt, but like, that's not, it's a bad analogy, I suppose. So it's like this thing that's on a cooldown in order for it to be effective, but I guess in games, if you could spam your alt, you would, but that's not how we work in psychiatry. So I need a different analogy. It's like a cooldown that, like, it's like blood magic, let's say, like where you like lose a portion of your HP to like cast a powerful spell, but you can't spam that shit. So generally speaking, I try not to spam hospitalization and use it only when necessary. Yeah, it's lay on hands. Yeah, so shrapnel sacrifice, that's what constitutes a suicide attempt. Providers ask me about my past attempts. I've been told that having the means and almost doing it doesn't count as an attempt. I don't know. So this is where like providers are going to be different. Some people will say it counts as an attempt, some people will say it won't count as an attempt. I think about, so what I do is I do a risk formulation. So it's not so much about, what is or isn't. It's not binary. It's like a risk assessment that's on a scale. So is this person low risk, medium risk, high risk, chronically elevated risk, acutely elevated risk? Like there's a lot of dimensions to assessing risk, right? And this is where we talk about means, history, current mindset, circumstances, current stressors, all those kinds of things kind of factor in. Dazzle Alt is a great example of what a hospitalization is. That's beautiful. Dean 77944. That's actually the best gaming analogy I can think of. So if you guys play Dota, you know this, but if you don't, there's a hero named Dazzle who has an ability called, it's not his alt, but it's Shallow Grave is what I was thinking. Where Shallow Grave, like, it doesn't heal you, but it prevents you from dying for a temporary period of time. And so when you like Shallow Grave someone, like, you can keep them alive for like, a certain period of time, but like, they're not actually gonna be healed. So as soon as Shallow Grave ends, if they take, any damage, they could still die. So what I think about hospitalization is sort of like a shallow grave. So it's like a temporary measure that keeps you alive. But in my experience, hospitalization can sometimes fix things, but it's really about like healing you back to full. That's the important part. Axe Chalk Metal. I knew Culling Blade was going to come up. I knew it. I don't know what this is where the analogy falls apart. Axe and Blink. Axe is on your team, chat.
Okay, so that's a pretty good video. What are your thoughts on what he said? Did you learn anything?
Coming from a person that has been hospitalized 7 times, I still feel like there's a huge difference from
So, like,
wanting to get well, wanting to get better, and someone that just wants to use a hospitalization as a means to an end. Basically, they keep going, keep crying wolf, keep going to the hospital. Don't be that person. Like, generally,
it's hard to stop that. You were that person, though.
No, I didn't keep going to the hospital. I generally was intentionally suicidal. That's the difference.
So you're saying that they take responsibility, because there's a lot of people that you still think that
you shouldn't put the responsibility on your provider. That's the stupidest thing you can do.
But they can't help it.
That's the thing. Like, if you truly look back on things and you realize that you may be in a position and they might give you advice, listen to their advice. Listen to what the provider has to say, but ultimately it's your responsibility to do what you have to do to get better. They can tell you this and that, go to the hospital, not go to the hospital in general. It's up to you to make that decision, that factor to put yourself in a position where you think you will be more safe.
Sometimes family members just get sick of it and say that, then just go to the hospital. They don't want to deal with it. And then there's people that go to the hospital, yet they're afraid to actually get help, even though they should be in the hospital. I think that's even more of a problem than people that just gets hospitalized all the time. What's your opinion?
I still feel that generally it's better to go to the hospital than not go to the hospital, but like you'll notice there's chronic hospitalization where people just go and go. They're in and out. They don't take their medications. They don't listen. You got to understand that for me, I'm generally very well-to-do when it comes to mental health. I take my medications. I listen to the advice of my psychiatrist. I do DBT. I do other types of therapy to benefit me. I do distractions. I keep myself busy. Like I said before, I take my medications, and that's so important. There's people that don't take the medications. There's people that abuse drugs. There's people that are addicted to bad behavior, and literally these people are going to have a really, really rough time and probably in and out of the hospital generally
here's the conscientious example of my brother. Yesterday we were going to go out, and I asked if we can go to game night to a friend's house, and he said nope, he didn't have his meds. So in the way, that's good. He wants to be make sure that he takes his meds consistently.
You got to take your meds.
There's a lot of people. There's a few people that just forget and don't do it, which is.
And it's intentionally, maybe half and half their fault, half and half not their fault, but generally speaking, this guy knows what he's talking about. This guy knows how to actually take a risk assessment on a scale and try to provide
the best. Psychiatrist.
Try to provide the best advice, but ultimately it is up to you as a patient to make the best decision for you.
So in the end, psychiatrists
can
help you, but
they aren't
not
the means to the end. They're not the means to the end. It's you.
It's about support. They can offer you support, but in the end, it's still your own decision. Now,
there's going to be times in which you maybe have voices that you may be suicidal, that you may be not be thinking clearly. Those probably happen. And I was at a point where I was suffering for 6 months. I didn't do anything because I was just unaware of what could potentially be better. But if you actually look and see that there's people that function like me, that has gone from 7 hospitalizations, 2 partial hospitalizations, 25 to 30 different medications, and ultimately being in a clear state of mind where I do want to live my life. People like that exist. And I feel like if you want to actually get in a better position, you got to look at people that have actually accomplished that. And look up to me if you need to, because I've actually potentially got myself in a position where I am not hospitalized, where I'm not hospitalized, where I am not in an IRTS or a group home. I live at home. I may not be working right now, but at the same time,
psychiatrist once a year only.
Yeah, Kyle mentioned I only go to the psychiatrist once a year. That's all.
Talking to a friend that has psychiatrist, it's just really surprised.
So I used to go every month to see the psychiatrist, and now I only go once a year.
You thought you were very vulnerable back then.
But I was vulnerable because literally I feel like the medications involved to save me from having any suicidal thoughts. I still feel like if you're suicidal, it's better to try to find the right medication than literally try to force yourself to not have those thoughts.
So it's better to go through hell and take the risks and have. There could be a potential that you could find a better solution than heaven.
Well, there's probably a better solution than in trying to find the right medication than totally giving up.
What do you think about people where they get sick of people just being depressed and sitting in mud pies, and then the family member says, "Fuck you, you're just going to the hospital"?
Well, if it comes to that position, you got to try to listen to the patient or your loved one that is suffering. Try to not convince them, but try to encourage them to go to the hospital.
What if they don't?
And if they don't, you got to be that one that drives them to the hospital. Like for me, I wouldn't go for 6 months until my mom suddenly decided to just take me there because she knew I wasn't in the right position. You almost had to have a loved one kind of deal with their care at that time because you may or may not be aware of it. A lot of it came
on to me because I was always around Travis.
But the thing is,
negativity brought on to me.
You can't continue to keep asking for help because it could come into a cycle in which you cry wolf and then you cycle back and forth, and instead of them encouraging you, they instead become your enabler, and that is also not good. So be aware of that, guys.
Don't do it just to get attention.
Yeah, don't do anything to get attention. Do it for yourself to get well and be safe and live a life that you really want to live.
So what do you think about this guy? You think he's respectable? He knows being.
I would like him as a psychiatrist. I think he's pretty functional. I'm not a big gamer, so I don't know what the fuck he's talking about, but generally I think he's pretty warm and considerate when it comes to psychiatry.
So is there anything else that we need to talk about suicidality and anyone that's scared, and do providers force you into hospitalization?
My best advice, if you're acutely intentional that you want to commit suicide,
if you have a plan to go to the hospital, it doesn't matter what the psychiatrist says. That 1 second could save your life.
Like he said, that intentionally, if you take your life, it usually happens in 1 to 10 minutes of your decision making. So be aware that you could be at a position where you don't want to be hospitalized, but if you have this intention and it's getting worse and worse, go to the hospital.
Think about it.
Safe than sorry.
1 second, when you pull that trigger, you're gone. You're not coming back.
You might hate the hospital, but it keeps you safe in an area where you can't potentially harm yourself with a weapon.
My dad had someone that we mentioned. My brother made a kind of piano performance with him, Dave Klein, and That 1 second, if he just called someone, if he just went to the hospital, if he took his meds, he would have been...
That overdose
here.
could have been prevented.
And my dad felt really bad that he wished he was alive. So, again, it affects you. So basically, you better go to the hospital. It's better to be safe than sorry.
But in the long run, if you continue to the hospital, in and out, do bad behaviors, addictions,
I still
not
think
take your medication.
I still think it's
people
worse.
like that exist.
If you had to compare, I still think it's better for a person to consistently go to the hospital and try than someone that where their loved ones push them in the hospital and they just leave. And we know that someone, don't you think?
Well,
or are they both the same?
I don't know. It's really up to your own perspective, but generally, if you're unsafe and you have the intention of committing suicide, go to the hospital. If you are at that means to an end where you want to end your life, if you're having suicidal thoughts that pass, you're able to distract yourself in activity or cognitive behavioral therapy or dialectical behavioral therapy or any type of safety mechanism, environment, support. If you have that in mind and you're able to get through the day, pat yourself on the back, and you don't need to be hospitalized. But if it's continuously repeating day in, day out, and you're getting so sick of it, of living, go to the hospital.
Do patients have rights, and should they be afraid about providers controlling their every health?
They shouldn't be afraid, because generally they want to help you. But in essence, if you want to get well, you got to take those steps to be proactive. You got to be proactive. You can't have them take that for you. Can't just go on a ride and hopefully that they'll you'll benefit. You got to take that responsibility to want to get well. And that's the biggest conclusion I come up with. When it comes to helping others, the biggest thing you can do for them is let them be, try to encourage them, but you can't just force someone to do this and that. Commands don't work.
I think he changed the name of this title because this video is not about therapy. I know there's people that think that if you tell your therapist, they think you'd think they'll push you in the hospital. This actually is more about a video about suicide and hospitalization. So a therapist, here's another example. When I went to my therapist the first time, I was scared as hell. And I actually was expecting them to give me meds, but that wasn't their deal. A therapist is totally different than a psychiatrist.
What the hell happened when you first went to the psychiatrist? Why'd you let them ring you like that?
Because I didn't know about it. That was my first time.
See, ignorance can really not be bliss there because it sucks. If I had to give advice to someone that's just starting their mental health journey, please take the responsibility to listen to your own body. Please take the responsibility to encourage yourself to find the right medication, to keep trying to go on that path, because the mental health journey goes on for a lifelong period. It's not something that clicks in and clicks out.
So deep down, a psychiatrist, therapist, all those providers, family, friends, deep down, you know about yourself, even if you don't think you need to be competent.
Everything
with your own
whatever you do, whether you are aware of it or not, you make a fucking choice.
So you don't sign on the dotted line where they take control of all your health.
For instance, you can blame all yourself for having them prescribe you something, but in the end, you made the choice to let them do that to you. And
you used to be mad.
And looking back, I realized I did have a choice, that I could tell them I didn't want to be on medication.
Remember, my ex got you got really mad when she said it's still your choice.
It is my choice, and in the end, after learning that, it is ultimately my choice.
So what do you say about people that are suicidal? Is that their choice? Or is it more about them?
It's not their choice to have the thoughts, but it is their choice to be proactive. So if they want to get well, go to the hospital, take medication, go see a therapist, go see peer support, get yourself in a better environment, try to use cognitive or dialectical behavioral therapy, whatever it takes to get yourself well. There is no means to an end when it comes to psychiatric help. It's a lifelong process, and you got to be patient. But you got to have that urgency to actually get yourself well on a daily basis. You can't simply say, "Oh, I feel like shit. I don't want to do anything." You got to be proactive and take that step to getting yourself in a position where you want to get well.
Again, be nice to yourself. Sometimes people just don't know any better. We didn't know any better. Sometimes you live and learn. So is there anything else we need to address about suicide?
Well, one last comment. If you look back on yourself, who do you have to blame when it came to your medication fiasco back in the past where they overdosed you?
Maybe it wasn't anybody's fault because we didn't know, and
they didn't know. And
So
so
sometimes you have to suffer a little bit and just not place the blame.
I hate to say
Sometimes
it.
it's about
If you
lessons.
want success, you're going to end up failing. There's
You
gonna
have
be
to.
there's gonna be really bad days, and generally you got to suffer through them if you want to find the day that actually works well for you.
And Travis suffered and he found better days, same with me. So I think that's it. So if you really like, this guy is kind of more targeted towards video gamers and a millennial, but I really like watching him because he posts a lot of stuff. He interviews a lot of people. He actually end up making people cry, and he can pinpoint and listen to people's problems. And we might be doing another reaction video with him sometime soon. So anyway, you can reach out to him at healthygamer.gg. And if you like our videos and our reaction videos and educational, sometimes the best person that actually knows about mental health and suicide is the one that actually experienced it. And we definitely have that experience, especially my brother, so he knows a lot. So if you like this video, please like, comment, and subscribe, and hit the bell button to stay up with future updates.
All right, take care. Have a good one. Bye.
Happy 4th, everybody. Bye.
Yep, happy 4th of July. Happy Independence Day. Bye.